When we compute variance from clinical measurements, we end up in squared units. Taking the square root brings us back to the original measurement scale. The standard deviation is the square root of mean squared deviation from the cohort mean. It expresses how far a typical patient sits from the group center. Squared deviations emphasize patients far from the mean. The square root undoes that scaling, so the result can be compared directly to the measurement. The standard deviation lives in the same space as blood glucose or biomarker concentration. The standard deviation gives the typical distance a patient deviates from the cohort mean. It is the direct, interpretable scale of spread in a clinical population. Two patient groups can share the same spread while having very different underlying structure. A single bell-shaped population and a mixed group of responders and non-responders may look identical in spread, yet they require completely different clinical interpretations. The standard deviation restores the measurement scale, but it cannot describe the shape of the distribution. It does not detect asymmetry, multimodality, or rare extreme events. Distinct patient populations can share the same spread while having fundamentally different clinical profiles.